Sternocleidomastoid muscle. This muscle originates from the sternum and the clavicle and inserts into the mastoid process of the temporal bone. The sternal head of the sternocleidomastoid muscle originates from the upper part of the anterior surface of the manubrium of the sternum, while the clavicular head originates from the medial third of the clavicle. Trapezius muscle. This muscle originates from the occipital bone, the nuchal ligament, and the spinous processes of the cervical and thoracic vertebrae. It inserts into the lateral third of the clavicle, the acromion process, and the spine of the scapula. The clavicular part of the trapezius muscle originates from the medial third of the clavicle. Deltoid muscle. This muscle originates from the lateral third of the clavicle, the acromion process, and the spine of the scapula. It inserts into the deltoid tuberosity of the humerus. Subclavius muscle. This muscle originates from the first rib and its cartilage and inserts into the inferior surface of the middle third of the clavicle. Pectoralis major muscle. This muscle originates from the clavicle, the sternum, and the costal cartilages of the upper 6 ribs. It inserts into the intertubercular groove of the humerus. Sternocostoclavicular muscle. This muscle originates from the first rib and its cartilage and inserts into the anterior surface of the medial end of the clavicle. These muscle attachments play an important role in the movement and stability of the shoulder joint, as well as the overall function of the upper limb. Process of ossification. It is the first bone to begin ossifying in the embryo and continues to ossify throughout childhood and adolescence. The ossification of the clavicle bone occurs through 2 separate ossification centers, the medial and lateral epiphyses. Medial epiphysis. The medial epiphysis of the clavicle bone begins to ossify during the 5th or 6th week of fetal development. It is the first ossification center to appear and forms in the midshaft of the bone. This ossification center expands towards the ends of the bone, eventually fusing with the lateral epiphysis. Lateral epiphysis. The lateral epiphysis of the clavicle bone begins to ossify during the 18th to 20th year of life. This ossification center forms at the distal end of the clavicle, near the acromial end. It grows towards the medial epiphysis, eventually fusing with it between the ages of 23 to 25. During the early years of life, the clavicle bone is primarily composed of hyaline cartilage, which gradually ossifies over time. At birth, the clavicle bone is only partially ossified, and the 2 ossification centers are separated by a cartilaginous portion called the clavicular disc. Clinical features. The clavicle may congenitally absent or imperfectly developed in the disease called cleidocranial dysystosis. In this condition the shoulders droop and can be approximately anteriorly in front of the chest.